Okay, so can you tell me your name?
Bernie Broom.
Okay, and where do you work right now, Bernie?
I work at Olathe Medical Center.
And what do you do for Olathe Medical Center?
I'm a cardiac rehab nurse.
Okay, and so we're going around and we're asking nurses in the field right now if you could give new nurses any kind of advice about legal liability and ways to keep themselves safe and protect themselves. What advice would you give to a new nurse?
The first piece of advice I would give is, first, you need to understand that you'll probably never totally avoid litigation. Even the best nurses are going to be called in to either be deposed or at some point during cases for certain pieces of evidence. If they took care of a patient and that family decides to sue later, it's going to be every nurse that ever took care of that patient. So you need to know that first, and with that in mind, know that always follow your policies, always follow protocol, only chart what you see, what you do, and that's it. I mean, the basics are best. Just follow the basics, follow the protocols, and you'll be fine. And chart, like I said, chart everything you do to a T, so that there are no loopholes for them to find.
Okay.
And that's my best advice. But I mean, I think it's important to know that there's never going to be a way to avoid it, because I've had, I personally have never been called in, but I've had several friends that took care of patients that ended up dying later, and then they go through the chart and they look up every nurse, then call them all back for depositions. Just based on every person that took care of them, and they had to go back and they had to remember their patient from that little piece of charting that they maybe had that day. So that's difficult when you only have a little few sentences that maybe you charted that day on a patient.
So be ready no matter what.
So be ready,
Okay.
It gets more difficult nowadays with the computer charting. I'm not in that area right now where I'm doing a lot of charting like that. I do mostly narrative in my area that cardiac rehab does, but I know like the unit and a lot of the other places do computer charting or the clinical pathways, and it's very standard what's outlined on those. There's not a lot of personal things you can add to those, so it is harder to remember, okay, this was that patient, or they make it very, very black and white, and I think too that's to safeguard the nurses.
Okay. And so would you, if I asked you if you could recommend to new nurses, would you recommend that they get outside liability insurance outside of the hospital that they work for, or would you say no?
I'll tell you what people told me, and I think this is realistic, that the hospital or the company that you go to work for, you need to make sure that they have coverage for you, and that should be okay, because I've heard that if you get your own, then that tends to be kind of a flag to kind of zero in on you, to go after you more, because they know that you have your own coverage. That's what I've heard in the past. Not to get your own. If your company that you work for, your hospital you work for has their own, obviously are going to insure you, then you should be fine. You should not have to get additional coverage.
Okay. And do you have your own additional coverage?
I've never had my own.
Never had your own additional coverage?
Never.
Okay. That's great. Thank you.
I didn't even look into